So in this exercise, we are going to perform the adductor squeeze test that is used to evaluate the strength of the adductor muscles and to identify any growing pain in the patient. Okay, it's easy to perform it. The patient is going to be put into supine decubitus, where the therapist is going to put his fist between the legs, and we are going to ask the patient for a contraction of the adductor group muscles, and we are going to evaluate it and to assess the strength of them. So in this case, we're going to perform an exercise in a recovery stage of a patient that suffers any growing pain or an athletic pubalgia. So it's an exercise that combines isometric concentration of the adductor muscles group and an eccentric contraction of them. So we're going to start it. We can perform it for 3-4 times, as many times as necessary to gain strength and to follow the recover of the patient. So the patient is going to be in supine decubitus, and the therapist is going to be in front of them with his arms between the legs of the patient, between the knees in particular. And we ask for the patient to consent to a contraction of the adductor muscles for a 6 seconds duration to keep a concentric and an isometric contraction. So later we put out our arms, and the patient have to control all the range of motion of the legs to perform an eccentric contraction. So we are going to have rest for 2-3 seconds, as many times we need, and we can perform it for 3-4 times to perform it well. And this is an exercise that is useful to gain strength and to keep a good recovery with a patient that have growing pain or suffer any injury of the pubis. In this case, we're going to perform a technique to treat the myofascial trigger point in a patient. In this case, we're going to use the classic spray and stretch technique. That is it's not so difficult to perform it well. So the patient, in this case, we're going to treat the infraspinatus trigger point, so that presents anterior pain in the shoulder. So we're going to put the patient into a comfortable place. In this case, we don't have a bed. That is going to be the best way to perform it, but we can use also a chair. We can put the patient into a comfortable position, and we are going to perform spray over the muscles in the pain pattern in this case. So and later we can stretch the muscle passively or actively. It depends on the patient. In this case, we can combine us. So the patient is going to be put in the chair, and we are going to ask for the patient to put a position of the stretching of the infraspinatus, in this case with the internal rotation of the arm. And we can pass the spray over the pain pattern our times as necessary for 2-3 times, and at the same time we are going to stretch the muscle passively. In this case, it's going to be actively. And that's all for this technique. That the main goal is going to be myofascial trigger point treatment to decrease, in the first case, is pain, and obviously possible other single symptoms, as can be the range of motion limited.